Mga barangay, good evening po. I hope you're doing well and staying safe. And tonight we have another Barangay Canada vodcast. And this is one of the more interesting episodes that we have because it's a great privilege to have as a guest a great light in our community, not just the Filipino community, but the larger Canadian community, because joining us tonight is the first and only so far Filipino-Canadian who has been a member of the House of Commons. So mga barangay, please join me in welcoming Dr. Reynaldo Pagtakhan. Dr. Ray, good evening po.
Good day.
So how's life during the pandemic? How have you been coping?
Well, it's a life of discipline, meaning you follow all the measures announced by public health officials to avoid exposure to the virus, and so contribute to the control of the pandemic and the spread. And so that is what I've been doing. I have stayed at home since January and concentrate on writing and reading. Speaking of writing for our Filipino community newspapers on the global pandemic itself, about the symptoms of the disease, the transmission of the disease, about immunity, and the development of vaccine, on aspects as they are reported in the news and in medical journals. I try to distill some of those issues and transform them into the community publications for the information of the members of our community and our friends.
I saw your article on the Filipino Journal about the COVID-19 pandemic, and
Yes.
that you were saying that it should be a global concern.
Yeah.
That was back in January.
January.
So you were the first to sound the alarm.
When I wrote the first submission on the COVID virus, yes, you're right. I call it the global concern.
Yeah.
And in fact, it coincided the issue as it came out about the declaration by the World Organization that it was and it has been a global emergency.
Oh, okay.
And since then, many things have been learned about the disease and about the virus, and we continue to learn. And even today's issue of the CTV News report, there are a lot of things yet to learn about COVID virus, and the community has to be informed continuously, I feel.
And that's why you're the perfect guest, Dr. Ray, because a lot has been said about this virus, and there's a lot of fear going around, but not everybody seems to understand what actually happens to a person when you get the virus. There's just there are different ideas floating around. So I guess the best way is to have you explain to our
the virus is dominantly a visitor, an unwelcome visitor to our breathing system, to our respiratory system. And because it has the greatest attachment or predilection to enter the lungs. Okay? And from the lungs, then the virus spreads and the damage is spread to the rest of the body. And in fact, we have since seen description of infections among children with various type of diseases, inflammation of the toes and in the skin. And then, of course, the heart failure and liver failure, kidney failure, but dominantly it is an infection of the respiratory system.
And also, thanks for that information, Doc. But also, this disease has been characterized to be deadly, especially for those who have pre-existing medical conditions like heart conditions, high blood pressure. Of course, age is a risk factor, and weight.
You're right with that. Obesity, okay, hypertension, as you said, or high blood pressure, heart disease, and because when we have underlying diseases, our body system is already compromised. So if you add another disease and another challenge to our immune system, of course, now you have double jeopardy of illness.
Yeah.
So you are, it has been shown from the observations as reported from China that those with those underlying medical conditions become more susceptible to the severity of infection. And that is why the occurrence or the occurrence of deaths, unfortunately, is much higher among seniors with these underlying medical conditions, or even non-seniors if they have these underlying medical conditions. But over and above the underlying conditions as contributing to the development of severe disease, the age itself, above 60, makes the person susceptible to getting the infection to begin with. So on two counts, by age, just the nature of age, above 60, you are more susceptible to the disease, to the infection, and getting it, and then getting it with the underlying medical conditions, you are vulnerable to develop the severe form of the disease. So two points that we have to underscore and emphasize to the public.
In the early days of this pandemic, a lot of people have been skeptical about the severity of COVID-19 because there were reports that people get the virus, they test positive for it, but all they develop are, mild symptoms like coughs and colds. So some people outright dismiss it as a hoax, that we're overreacting. But you mentioned that once you get the virus, you will just develop the severe symptoms afterwards. Is that correct? Or you might not develop the severe symptoms.
Well, we can say that at least with the first report on this disease, they reviewed about 80,000 cases in China, okay? And that is the very huge compilation of subjects. 80% of them do not really have serious problems.
Yeah.
Only about the 20% have serious problems. And then of the 20% who have serious problems, if you're seniors and like that, then about 5% can really have very, very critical problems. So the very mild, it's about up to 80% of the total population of patients, at least the first estimate. Then the 20% will have moderate disease, and the last 5% will be really severe and critical, meaning the patients will need oxygen treatment as well as even the mechanical ventilation. Again, to be emphasized is that the seniors are the most vulnerable and susceptible to the disease and to its severity.
Although there have been recent reports, and it's always been played up, that if there was a senior who was like a patient from this COVID-19, and then they managed to recover from it, it's always played up in the news, like
there will always
100-year-old so-and-so are getting out of the hospital.
Recover, and we hope we will have more of them.
That's true.
But on the average, of course, we are speaking when you speak of the group of people, and we continue to learn. And in fact, this morning's report from CTV News, this scientist and doctor from Toronto will be doing a project, and he would like to engage some 10,000 Canadians, and he would like to draw samples of blood, okay? And the samples of blood will be done as though if you're testing for people with diabetes, just by fingertips. You can put it in a piece of paper, then you will dry the paper. You can send the specimen to the laboratory after drying the paper for 2 hours, and then they will begin to examine the presence of antibodies, meaning those proteins in the blood that protect the patient generally against a disease. Now, what this study will do, it has many implications and contributions to make. Once they look at these figures, at these occurrences, numbers, they will be able to tell us if the antibodies were present, okay, the protective proteins in the body, how long do they stay protective in the body? 6 months, for a year, or for life? We do not know that yet at this point. Okay, so that then we will come to know that. What is really the occurrence of the infection in the community? We still do only have estimates at this time, but it is not yet the closest estimate. we know that there are now observations about patients getting infected but not getting the disease. In other words, they do not develop the symptoms,
Yeah.
but they get the virus inside the body. Okay? And that, in fact, is a source of concern because we do not know who are people still feeling well, walking about, and get, at the same time, is a source of infection. And that has implication in terms of public health and how we distance from each other and how we talk and sing, because all of those things are mechanisms or activities that are involved in the appreciation of the disease and its spread.
I have a question about that, Dr. Ray, because from what I understand, the virus is spread through droplets, right?
Yes.
And then, so if someone is asymptomatic, doesn't have the symptoms of coughing or sneezing, then how can that asymptomatic person pass on the disease?
Yes. And then, of course, if you are with the transmission of disease via droplets, which still is believed to be the major pathway for transmission, okay? The droplets, meaning the saliva, the mucus coming from the cough, okay, the virus will be there. And so the virus
from just talking, right? From just talking.
Either by cough or sneezing, okay? And or even by singing, okay? And there is now evidence that all of these things can be activities associated with the expulsion of the virus from the patient to another person. Okay, now that is about the transmission of disease via the droplet mechanism. The droplets are heavier in as a substance and therefore will fall down before they reach the within about 6 feet or less, they will drop down. And that is the reason why we are told to distance about 6 feet away from the other person. Now, having said that, a study has been shown now that when you speak, and you speak loudly, and if you sing, in fact, the saliva can carry this much farther than 6 feet.
Okay.
Then now there is concern that it can be longer than that. And then in one choir practice, where the outbreak of the disease happened, that is what they observe as the source, is the singing. You sing loud, and then you get your voice out.
The choir was the source.
So singing is in a group can be a source of transmission. But then the other one now, after that initial observation or original observations, came about the observations that they can be transmitted by aerosol. Now the difference between aerosolized and droplets, the droplets are heavier, they drop down right away or within a shorter distance. But if it's aerosolized, meaning they're a finer thing, they stay in the air, in the environment for much longer, and therefore can be inhaled, for a greater chance of opportunity of inhaling those virus in the as an aerosolized form. And because of that, then it is now also believed as a source of as a pathway for transmission. So there are two pathways now likely, and that is by droplets, still dominant pathway that everybody believes, and a transmission through the aerosolized form. And it all depends on, because when you aerosolize, you're dealing with the finer kind of particles. Yeah.
From how you describe those modes of transmission, it sounds like we should all be wearing masks now, but it's not mandated yet.
Interesting. In China, in Japan, and Korea, it is a way of life. Once you get a virus infection, whether it's influenza or colds, these are all viruses, they wear face masks. Okay, and for a good while, the World Health Organization, the United States, and Canada say, well, it has not been shown as effective. And then but the doctors in the hospital will need them, and that to me was bothersome. If the doctors would need them and they can be protected, well, why not a person too, right? Now,
exactly.
I can see the difference, okay? Because there in the hospital setting, you are really dealing with a big dose of the virus.
Right, it's all around you.
Particularly if you're dealing with the patient infected himself or herself. So it's a close exposure, and I hire those. So I can see that, okay?
Yeah.
Two, if you get your uniforms, your protective equipment, and then you accidentally sort of shake them, then all these virus particles will be in the air.
Yes. Yes.
So the use of masks is good, okay? And that is why you will observe that when I wrote about the transmission, okay, and I say about masks, I did not mention about face masks. Not yes and not no. But I know that the World Health Organization says no, you do not need it. Public Health Canada says so. USA CDC says no. I could not accept it. But I have no evidence that we should do it.
Okay.
Until that report that in fact documents from the laboratory and clinical observation that there can be a aerosolized form of transmission. So I said they should use it then. And so then when it became obvious that this information is coming stronger and stronger, then now Canada, USA, the World Health Organization is advising on that. The next question about that, which you raised earlier, should it be mandatory or not? Okay.
Yeah.
If it is good, should it be mandatory? Now, there is a real serious issue to that. Okay, if you make the need for masks mandatory, okay, in the public, okay, when you make something mandatory, you have to have a regulation or a rule or a piece of law that in fact one violating that mandatory obligation is penalized. Otherwise, what is the value? Okay.
Oh, that's right. Yeah.
And that is a very difficult issue, because what if 1,000 people refuse to wear a mask? You're going to get 1,000 people in jail, or 1,000 people receiving tickets and fines. It has to be handled properly. To me, the best way is to say, okay, this is important. Okay, let us use mask, and then said, okay, and we will depend on your goodwill to protect others, okay? Because you may have the virus, not so much to protect you, but it would also protect you. So it would be a two-way benefit for you and for your neighbor, friend, or casual contact. So, but I would approach it from the point of view that it is advisable. We advise it very strongly. Okay? It makes common sense, and let us sort of treat and respect and be kind to each other. And that I think will be more useful than making it mandatory, because there will always be some who may just refuse to be ordered. And so that is the weakness of human nature.
I agree with you, Dr. Ray. Actually, there are some locations, I will not name where they are, where there's some sort of negative peer pressure. And by that, I mean, people are not wearing masks. And if you wear a mask, you would stand out like a sore thumb, you know? So there's negative peer pressure. Everybody's not wearing masks. So you take off your mask so that you would fit in.
And this is the difficulty. And I think as we go on and learn more about it, learn more about the disease and the many aspects of it, yet that we continue to learn from research, then I think the approach to it in terms of the measures that we can do is will become clearer to people. And when it is a recommended behavior, that I'm an optimistic person, that there will be greater likelihood of compliance and obedience for the sake of others, if not for our sake.
But since we're talking about masks, Dr. Ray, we might as well widen the topic to the whole government response. So how would you assess the response of the Canadian government with regards to this pandemic? Because in other countries, the governments there are being judged by their citizens as to how well or how poorly they responded to the pandemic. What about Canada? Do you think they're enough? Do you think we need to do more?
To have a lower number of cases and a lower number of deaths.
Yes.
Although we now have about 90,000 and about 7,000 deaths, okay, it is still, the numbers are still a low percentage, about a third of all the cases in the world, about a third, no, not a third, a 0.3% of the cases in the world, and the deaths will be 0.1% of the deaths in the world. So we are fortunate and we are grateful for that. Okay? But we should not be complacent, because whenever there is still an infectious person in the community, then there is a risk to it spreading again. Okay? Because unless such a time that the virus can no longer be transmitted, or there is no more person left, then the virus sort of dies down, then it may recur. Okay? And that is what we still do not know much about the second wave. Okay? The experts, the public health officials say they are likely to use to come back, in second wave and third wave, because the experiences with other viruses, like the H1N1 influenza virus, they happen. So it is a known behavior of a virus to come in waves, sometimes related to the season, sometimes independent of the season. Okay? And so we have to watch for that in fact, when it happens, we are prepared. And that's one of the issues I'm trying to pay attention to, because of what happened to our long-term care homes, where the most vulnerable of our citizens reside.
So now that you brought up the second wave, Dr. Ray, so now that all the provinces are slowly reopening their economies, so is this something that you agree with, or there should be more caution to how we're returning back to normal?
Yeah. Well, in fact, the new normal is now.
Yeah.
Unless
this is the new normal. That's why I'm talking to you.
That's why we are doing it by Zoom. Otherwise, we will be using it in my living room.
That's
or in
correct.
the office. Okay. And the normal now is here. In other words, we continue to hope that a vaccine will be developed soon. But the history of development of a successful vaccine, in the history of vaccines, the last time I reviewed that, was the earliest that was developed and shown to be effective and safe. It took them 4 years.
4 years.
To have that. That was
wow.
the vaccine for mumps. Okay.
Okay.
Now they believed, and that is why when the experts, Dr. Fauci from the United States and here in Canada, they will tell you that 1 and 1.5 years may take before we know. Now people are saying, no, in 6 months we will have it. Okay. Well, everybody hopes for the soonest, but the reality is that it is not the experience. Now, we have to make it a difference here. The two phases in the evolution of a successful and effective vaccine. The development of the vaccine in the laboratory, testing with the animals, okay? Seeing the efficacy, producing the antibodies, all in the test tube. That is the shortest part of the evolution of a successful and safe vaccine. The longest part is when this vaccine is ready to be tested among human beings. Then you have to be careful. Now you are dealing with human life. And so you would like to know that the amount of vaccine that you are giving is in fact effective. It is producing the desired result, the development of antibodies, okay? And if it is effective, is it safe?
Yeah.
Now, safety, to determine all the potential side effects, may take time to know, because a person may just develop this reaction, and then the 100th person may develop it. And that is why even after the introduction of the vaccine, they continue to monitor this new vaccine by the scientists and to see, and that is why any side effect or adverse reaction or unusual reaction is to be reported. So they will know over a period of time whether in fact that is a side effect that in the early trial has not been discovered because it was so soon. So a trial that is so fast, we take the hazard and the danger and risk that it may have not fully tested for all the side effects. But knowing how conscious we are about safety and health, those aspects are being looked into by all the investigators. And some of the vaccines being developed now may not be as potentially harmful as the old approaches to vaccine, which are still being used. Because vaccines can be developed by getting the virus and sort of kill the virus, and they put it in the laboratory, and then that becomes a source of a vaccine.
Yes.
Or they can make it weak, so it will not cause disease when given as a vaccine, but it's still alive. It's still attenuated, but still alive. Okay, but weakened. Okay. Or now, with all this new genetic science, they can take a part of the virus, and that is now what they're using. And that, of course, is less likely to cause a disease, and then can be developed faster. That is why there is hope for a faster development. But to say that in 6 months and to give a deadline, sometimes you don't like to give false expectation. We all hope that the vaccine is developed soon, but we should not give too much expectation because people could be disappointed.
I agree.
So in the absence of a vaccine, as you raised in one of our communications,
yes,
is can we develop a drug against the virus?
An antiviral, yes.
The vaccine is to prevent the disease, okay? To prevent the infection from developing into a disease.
Yes.
Infection is when you get the virus into the body, that is infection.
Mm-hmm.
To develop the signs and symptoms, that is the disease.
Mm-hmm.
That is why if you have no signs and symptoms, we call the persons carrier, not disease, carrier. Now, when you develop the disease, you have all the signs and symptoms, or any combination of that. You know, as we said, the lung system, the pneumonia, the failure, the other parts of the body, etc. So the evolution of the. So now, what we would like to do now is, can we have a drug, a treatment, or to prevent it, okay, from progressing or hasten the recovery of the disease?
Yes, yes.
And
so
there is one drug, it's called remdesivir, so far the only drug that has been shown in a very controlled double-blind study, which is very scientifically done, that shows it could hasten the recovery by about 4 or 5 days.
Oh,
People will say, 4 or 5 days, what does it mean, 4 or 5 days? A lot of positive implications, because if you can reduce the duration of a critical disease for 4 or 5 days, and imagine that patient is in the hospital and then in the intensive care, and you recover 5 days sooner, you will decrease the load on the intensive care units. You will decrease the load on the hospital. So 5 days is a significant difference that you hasten the recovery of a patient. That drug has now been shown, but the study is still continuing. But so much so that in the double-blind study, you have a what we call a placebo. When you give something of the same look and appearance to the patient, and the doctor and the one doing the care do not know about that, okay? But then at the end of the day, they will be analyzed, see the results. Now you will know whether what you see is the effect of the drug compared to the effects as may be seen in a placebo. Well, what so far they have seen in this study of remdesivir is, in fact, it is so convincing that the good effect, the hastening of recovery, has happened with the remdesivir. So now they have to open the study and said, okay, it will now be the standard of care, no more placebo. Because you cannot, you cannot continue to do the placebo just to get more number of people. No, you balance that. But at the same time, now you will test the different dose of the drug. Say dose this much of a strength, this bigger of a strength. It's still with the same drug, but everybody is doing it. You know, in other words, if you increase the amount, do you increase the recovery even more days? We do not know that yet. Okay, or do you have to do that, but you may have side effects until you remain with this? That is now the state of situation with this drug as hastening recovery period, but it is not considered yet a cure. The scientists are emphasizing that it is not yet a cure. It is still hastening of recovery. Because the cure is that is still the ultimate goal if you have a disease. The other challenge to the scientists would be, can you develop a drug that will prevent the disease when you are exposed?
Right, a preventive.
In contrast to a vaccine, it's almost like a vaccine, but not a vaccine.
Yeah.
Okay? But you take it early and you take it continuously, like daily. You know, and the antimalarial drug, if you go to an endemic place, they will use this hydroxychloroquine, which of course the President of the United States tried to market, and unfortunately, that was a bad approach.
Yeah.
And yes, because patients in Nigeria and in Arizona took that news from the President of the United States on their own, took sample of this drug in Nigeria. Patients ended up in the intensive care unit. And then in Arizona, took the equivalent of this drug, the chemical that is used in the fish tank. And of course, one of them died and one went into coma. But now they have done the study. They reviewed about 10,000 patients. It does not help with the disease. In fact, it could increase the number of deaths. So I think we have now established that hydrochloroquine, or at least the scientific community has established, hydroxychloroquine is not to be taken by patients with COVID disease. Now, I say this because in the Philippines, I got a communication from one of my classmates. I said, this is standard treatment. And I do not blame them, because this was treatment being proposed also, not only in the Philippines, but in England, okay, in Australia, in China, in Saudi Arabia, in Dubai, and I have this contact. How it started, I do not know. But one study was published from the French community. Okay, very sad. The title of the study of the report, "Cure for COVID," very definitive, very definitive, right? When you look at the data, there are only about 26 patients. Okay, and then about a third of them are without symptoms. So maybe the mild one who will recover on their own. And then the one patient given hydroxychloroquine, one of them was dropped from the analysis. Well, this patient was dropped because she went to the intensive care. I mean, that is not a data that you will say give you confidence that the drug is useful. Okay, so I sent that. I sent that abstract to my classmate and said, tell our people there, be cautious. It is not a drug. Okay. Unfortunately, a statement like that from the leader of one country could have a very impact on the fears of people desperate for an assurance of cure. Okay? And so that is the danger on the part of a leader of a country to continue to say that. And then one day he would say again, maybe weeks later, oh, I take it myself. Anyway, now to me, the final news is that even the World Health Organization doing this study now on another study, because Canada was part of the study. You will test this thing. They now have started. They are now opening the protocol and they will review all the patients before they continue. Because of that one study in the States published in the New England Journal of Medicine that says they can do more harm than good.
Is that also being explored with COVID-19, like a combination drug treatment?
Well, one of them is, in fact, supposed to be tested in Canada, is remdesivir and hydroxychloroquine. Now that
so it's been going on.
It will not take place. Hydroxychloroquine also has been recommended before with the antibiotic azithromycin. And in fact, when combined with the drug, it's even worse. It's worse, okay? Because the drug itself, although approved for use with people with malaria and approved for people with rheumatoid arthritis, okay, and some lupus, okay? But these are based on clinical trials, okay? And so although the drug could have potential side effects, they are really indicated for this condition and helping this disease, rheumatoid arthritis and lupus.
Okay.
But for COVID, when you have no beneficial effect to the disease, and you can have the side effects, well, common sense dictates that we do not use it for that condition. And that is now the state of the situation with respect to hydroxychloroquine, also known as plaquenil in the Philippines.
I see.
And it should not be used. Now we have more solid evidence that it should not be used.
I see. But I also remember there was the Prime Minister made a statement that to solve this pandemic requires global cooperation. And is that something that you agree with, that we can't solve this by ourselves here in Canada? We have to rely on other countries as well? And I have a follow-up question to that. But first, if you can weigh in on that sentiment from our Prime Minister.
So are you referring to sort of our global obligation?
No, just global cooperation to solve the pandemic, our global response.
No question. No question. You need global cooperation, okay, in all aspects, okay, in measures that will help decrease the transmission of the disease, in the development of drugs, and in the development of vaccines. You must have global cooperation. Let us go back to that vaccine. When developed, will they be available when we have a safe and effective vaccine? Will it be available to all people in the world? That is now being discussed as well. Because now at the present time, the vaccine development, okay, is being done in a few countries. China, in Asia, it's being done there, in China, in Australia, in the United Kingdom, in America, and in Europe, okay? But when you put all these countries together, how many do they represent? 75% of the world population. Now, if the vaccines are of a limited supply, who will get them first? That is the issue and challenge now to the world, to the global leaders. We would like the vaccine to be to everybody in the world. Because if you only vaccinate, say, 75% of the people in the world, then the 25%, in light of our global world, the travel and everything and business, then they will continue to be reintroduced. And there is a case of there is no 100% success with vaccination, at least in the initial phase. If they're all vaccinated, fine. But there will be, say, the 5 or 10% of population who refuse to be vaccinated for whatever reason, then there can be a source of a renewal or wave of infection.
But does it not assume that everybody, that all the nations in the world are working towards coming up with a vaccine? But my follow-up question is, Dr. Ray, of course, it's well known, our neighbor to the south has the most active cases, or has one of the most active cases in the world right now. Actually, they might be the source of the second wave because of all these protests, and the social distancing has gone down the drain now. So what's going to happen there?
Very serious implication, very serious. And I am glad that about a week ago or so, the Prime Minister announced that the travel ban between the States and Canada is sustained until the end of June. Unless it's for essential business and trips. The recreational travel, the visiting travel for leisure and everything is still banned between the United States and Canada. So at least one measure that hopefully we can contain and limit the entry of new infection and cases. So yes, it requires a global solution, but if one country, and this one in this instance, a big country, and in terms of Canada is our neighbor, the longest land border in the world, that we are at risk. Okay?
That's right. That's
a great risk. And so we have to continue to monitor.
Oh, go ahead.
We have to continue to monitor that. The Prime Minister announced that the travel ban between the United States and Canada will continue until the end of June. They did this at the end of May, now the end of June. If the situation is worse, I'm sure it will be extended again.
No, so it's good to hear. It's good to hear that from you, Dr. Ray. That it's confirmation that everybody's concerned about that, because people are monitoring the news because of the racial tensions in the U.S. after what happened to George Floyd and numerous other African Americans, how they've been victims of police brutality. And now there are riots and protests and lootings going on. So people are wondering, how does that affect Canada? And you just answered that with your response that this travel ban is in place until the end of June, and then it's renewed.
Well, I'm glad
every month or every period.
Because of the very, very sad killing of an innocent citizen. I've noted the news that protests in the States are happening because of that situation.
Yeah.
And also, the protests of the same kind had happened in Montreal. And that is a sad event to watch. Okay? And hopefully leaders will take the respective roles to diffuse these feelings. Very, very agreed. And I think if leaders will sort of proclaim shortly and briefly and to the point that justice will be done, that the legal process will take place, the arrest has been done, the charge has been done, then I think it will diffuse the problem. But if they continue to add things that really are inciting and provocative, it will only continue. And unfortunately, not everybody is behaving that way among leaders. Okay? And I would not mention names, but it behooves all our leaders here and in the States and in the world to lend their voice. That in an instance like this, the solution is that let justice prevail. The normal rule of law be applied. And I think it will have diffused the tension on the source of tension on that part. Very, very serious issue. And certainly from what I have read about it, it is really a question of grave injustice that's been done to this individual.
And the way you said it, Dr. Ray, to me, you sounded more presidential than somebody we all know.
I'm Ray Pagtakhan from Winnipeg. in the suburb and rural area of Manitoba. To follow up on your question on what we do now, and that is why one of my issues that I sort of inspired me to title it as "Can we live in the midst of the virus? How do we live in the midst of the virus? How do we behave? Okay, and if we have no drug against it, we have no vaccine to prevent it. What are we to do? What are we to do? Well, when you come to think of it, there are only very few things that we can do, but at the same time, they're not expensive to do. In terms of how we will do it, one, we have a face mask. That's not very expensive. Two, you keep the distance. Again, that's not very expensive. And then you avoid handshake. I will refuse to do handshake for the next until we have the vaccine. I have done that with a few. I have told it with a few friends. No handshake. And one expert has said no handshake anymore. And in terms of how you greet, how you even with your friends, I mean, maybe we should change that. And I was my granddaughter, the youngest, one time she dropped by, and we maintained the distance. I was in the porch of 6 feet, and when I said like that, my instinct to hug her, she put her two arms on her chest and understood like that.
Okay.
And again, to tell that so when we sing the Bayanko or the national anthem, okay, and we put our right hand, as a part of our culture, and sing the national anthem, that is a good sign of peace with the neighbors, and we prevent the transmission of disease. Okay, so
right. I was thinking more along the lines of talking about this new normal. I was thinking along the lines of children going back to school, because unlike grown-ups, where we can actually avoid handshakes and other kinds of physical contact, with kids, it's normal for them to, when they play tag, or when they want to hug each other.
That is why even the return of children to school is still a very serious issue, because they can get the disease, not so frequently affected in a serious way, unfortunately, at that, but at the same time, they can be infected. Okay? And when they get infected and they do not get too sick, and we do not know they are sick, the question then is, are there carriers of the virus? We still do not know the extent of that, but the questions have been asked, and so we will continue to learn. And this particular study coming from Toronto, I think it's starting this first week of June, it's a good thing for us to participate. I mean, for citizens to participate and in that kind of research. And I will make it a next topic of my issue with the Filipino Express and the CanadianFilipino.net publication, to encourage us to participate, because then we contribute to the development of medical science, medical knowledge.
we will look forward to hearing those updates from you, Dr. Ray, because of course we're all anxious to learn when this pandemic would be gone or greatly diminished or whatever. Because I don't think a lot of us like this new normal.
So is your family doing good?
We're doing good. Working from home, and I'm living. Of course, I have my family with me, but I also have my mother, who is 65 years old, living with
High risk too.
us.
The high risk
And
too.
we're making sure that we're safe and all that. Now, switching over to another topic. Happy Filipino Heritage Month to you.
The independence.
Oh, I mean, across Canada,
What topic?
it's been declared since last year that June is Filipino Heritage Month across Canada, right? This year, though, because of the pandemic, there's no celebration.
So yeah, so you're making a project through online. That's a
That's
good idea.
right.
Yeah, good idea. And then spread the message of what independence means to us, and activities that you have seen. What people are doing.
So now, before we say goodbye, Dr. Ray, because I've already taken an hour of your time, I'm going
Yeah.
to give you a chance to leave a parting message to our viewers, to our kababayans, maybe about the pandemic or about Philippine Heritage Month or Philippine Independence Day.
Well, I wrote a few notes, bullet points here. So I said, as soon as I received your letter, and I said, mga kababayan sa Canada, Pilipinas at saan pa mang bansa, fellow Filipinos in Canada and elsewhere. This indeed a day is always a joy to remember and to celebrate, to remind us of our roots, our noble roots, and live up to them as a people. That our ancestors, we must remember, rejected oppression and gained independence and secured human dignity for our people. That we aim high, work hard, and succeed. That we share and care for others in the community. That we help and attend to the needs of the most vulnerable. That neighbors and strangers are our friends. So yes, this is a day to remember and celebrate, to remind us that freedom, like a coin, has two sides, to do harm and to do good. And we have chosen always to do good at all times, that we do our share of family and civic duties, that at this time in the world, as we endure the COVID-19 pandemic, we share and let us share our deep sense of humanity and human understanding. So on that note, I would like to greet everybody a happy Independence Day, 122 years today. Thank you.
Wow. Thank you very much, Dr. Ray.
You're welcome.
Stay safe. Happy Independence Day.
Family. Okay, bye now.
Bye-bye.
Bye-bye.